Now we're getting into physiology of blood vessels. So this slide here in front of you is looking at how water moves in and out of capillaries, either into the interstitial fluid or water moving from the interstitial fluid into the capillary. That happens by diffusion of water, or osmosis. And so there are pressures that are pushing, and there are pressures that are pulling. So when fluid leaves a capillary, we call that filtration. When fluid goes back into a capillary, we call that reabsorption. So here you can see on the next slide, I put the two pressures that drive filtration, and I put one pressure that drives reabsorption. So if you look on this slide here, it's actually showing that there are two pressures driving reabsorption, but the other pressure driving reabsorption is really inconsequential. So let's look at what's driving filtration. First is blood hydrostatic pressure, and that's just pressure from the heart. Your blood vessels are pressurized because your ventricles are contracting and generating that pressure. The second one, interstitial fluid osmotic pressure, has to do with albumin concentration. So water follows solutes. Just like water follows sodium, we talked about that when we were discussing hormones that deal with blood pressure, like aldosterone. Aldosterone encourages your body to excrete sodium, and or actually not the opposite, your aldosterone tells your body to hold on to sodium, and therefore you hold on to water. If you were to excrete sodium, you would also excrete water. Water follows sodium. Water also follows albumin. So wherever you have more albumin, that's where water will go. That will encourage water to follow it. So your body is able to put albumin into the capillary and out of the capillary. So as blood moves through this capillary, albumin is a larger concentration of albumin is out here in the interstitial fluid. So that's pulling the water out. And then as the blood continues through the capillary, you're going to find more albumin inside the capillary, and that's the blood colloid osmotic pressure. So you'll find more albumin in the plasma. Remember, albumin is one of the plasma proteins. So you'll find more albumin in the plasma, and that's kind of pulling the water back into the capillary. So more albumin outside the capillary pulls water out. More albumin inside the capillary pulls water in. And that is interstitial fluid osmotic pressure and blood colloid osmotic pressure. Depends on where you find more albumin. So you have filtration, you have reabsorption. We're going to talk, I believe the next chapter is talking about the lymphatic system. And so up here, they're showing you a lymphatic capillary, because the issue is that you have filtration, you have reabsorption, but there's more filtration than it gets reabsorbed. So fluid's leaving the capillaries in a greater amount than it's going back into the capillaries. And therefore you end up with too much fluid in the interstitial fluid. So you have to have some way, if you're not going to put that back into the blood vessel, you have to have some way to get rid of it. Otherwise you're going to swell. And so that's kind of where the lymphatic system comes in. And this is showing you a capillary, and all of these are like cells, and the water goes back in. So we'll talk about that in the next lecture. So blood hydrostatic pressure, interstitial fluid osmotic pressure, those are both pressures driving filtration. Blood colloid osmotic pressure is driving reabsorption. You're going to see something similar when we talk about renal function. This slide is just showing you blood pressure in the different vessels. So we always measure pressure in millimeters of mercury. That's what is written on the side here, mmHg. That's how we measure pressure. It's how we measure air pressure, like the pressure of oxygen in something. And that's how we measure blood pressure in millimeters of mercury. So that's what mmHg means. So let's follow this blue line first. You can see the pressure in the aorta and arteries is somewhere, it's really like closer to 100, but they've got it somewhere in the upper 90s. Okay, fine. You know, it's kind of dropping. And look what happens when you get to the arterioles. Remember what the arterioles are. I mean, their job is to slow down blood flow and slow down pressure, reduce the pressure before the blood gets into the capillary. Look how pressure drops once it hits the arterioles. Right? So between the arteries and the capillaries, the pressure drops significantly. Right? And then once you get, all right, so here you're at the capillaries, you're at the cell level, and then you're at the veins, venules and veins. And look, by the time the blood is in the veins, it is like 10. You know, this chart has it even less. So there's a difference between like 110, you know, coming out of an artery. So when the artery is coming down my arm, like let's say right here, the pressure is like, well, you know what blood pressure is. It's alternating between 80 and 120. I wish mine was. So we'll say around 100 on average, right? So that's in the arteries here. And then in the veins, coming back up, the veins in the same place, the pressure is like 10, 15. So it's a huge difference in pressure. By the way, this is showing you, the red lines are showing you blood pressure, right? It oscillates. It goes between a systolic and a diastolic pressure. And so what that's measuring is when you put the cuff here on the brachial artery, it's measuring what's the pressure on the wall of that artery when the ventricle contracts. Every time that left ventricle contracts, it pushes blood out, right? It doesn't, you know, blood, arterial blood is not like flowing, it's pulsating. Because, you know, the blood gets pushed out and then it gets pushed out again and then it gets pushed out again. So it's not like necessarily flowing, but every time the ventricle contracts, that blood gets pushed. When the ventricle relaxes, that blood stops. In fact, the blood even tries to flow back to the heart and it can't. So the blood stops every time the ventricle relaxes. And the next time the ventricle contracts, it goes. So, and that's the pulses that you feel, right? The pulse you feel in your radial artery, that pulsating is every heartbeat. Every heartbeat, that blood is going a little further and a little further. And, you know, pulses are places that are close to bones, where you have an artery at a point where you can feel it. And so, you know, there's also a carotid. There's a few of them. So that blood is pulsating through your body. So what is the pressure on the artery, wherever the artery is? Because you can also take blood pressure here anyway. What is the pressure on the artery when the ventricles are contracting? The lower number is what is the pressure on the artery when the ventricles are relaxing. So that's systolic pressure and diastolic pressure. And mean arterial pressure is something that they will do in hospitals. And I just, you know, I'm not going to ask you on a test. You don't have to like memorize this. There's two different ways to reach the formula. And I know when I put math in here, it messes people up. And I know machines do all this stuff, including take blood pressure. But, you know, it'd be nice if you knew at least roughly how to get mean arterial pressure. So it's systolic pressure, and then you add to that two of your diastolics. So I'm going to take like 120. For example, if we're going to say the blood pressure is 120 over 80, I'll take 120. Then I'm going to add two 80s to it, so 120 plus 160. I'm going to take that number, 160. I'm going to divide it by 3, which I can't do in my head. Wait, I'll do it in my head. 53.3. Hope that's right. Anyway, whatever. I got my degree. I don't have to know any of that. So blood pressure. So let's talk about resistance. So you also have opposition to blood flow. That's what resistance is. And so a good example of resistance is when you went from an artery to an arterial, and you saw how quickly the blood dropped, right? So there's different factors that cause the opposition to blood flow. And also that's going to mean that, you know, the pressure is going to go down. So one is the size of the lumen. So when you make the lumen smaller, like you do with an artery and an arterial, you increase the resistance. And I just gave an example here because it's not like when you make it half as small, hold on. Hey, get the door. Go get the door. I don't want to stop the video. I was already so into it. So when you decrease the lumen and make it half as small, it's not twice as much. It's actually 16 times as much resistance. So that's one factor. The second factor is more blood vessels. And I used an example here of roughly 250 miles of capillaries for every pound of adipose tissue. So every pound of fat, right? Now, capillaries, remember how small they are. I mean, they're tiny things, but you're talking about a lot more vessels. And so that's going to increase resistance. And then finally, the thickness of the blood viscosity. The thicker the blood, the more resistance you have. Okay, so we talked about how pressure goes down. There's a big difference between arteries and veins. By the time it gets to the vein, it goes down. Well, we have a problem because the pressure is lower, but in our legs, it's got to move up against gravity. So not only is the pressure a lot lower, it has to go up. And the heart, the ventricles, I mean, really, it's the left ventricle. The left ventricle is making all this happen. So, you know, we need some help. Otherwise, otherwise you're going to get, if blood can't make it up, you're going to get fluid in your legs or in your feet. You're going to get edema. That's not even, and everything gets backed up. So the first thing is that the veins have valves in them. And that's to kind of keep things from flowing back, right? So this is just kind of showing you a vein. And again, you don't see an elastic here, right? Because there's no need for elastic. There's no pressure. There's no muscle. There's like a tiny bit of muscle, but there's no need to do any major constriction here either. It wouldn't do a whole lot of good. So this is one way to help the skeletal muscle pump. So keep those valves in mind. And so this is in your calf. And as you take a step, the blood goes through this first valve. And then when you lift your foot to take the next step, that blood cannot flow back down because that valve will close. Then when you take the next step, it gets pushed up again, and then that second valve will close, right? So every time you take a step, that helps kind of push blood up in your legs. So that's one way, the skeletal muscle pump. Another way is the respiratory pump. So look at the person on the right. This diaphragm, so the diaphragm is right at kind of like at the bottom of your sternum, and it's not flat, it's concave or convex, whatever this is, curved up. And every time you breathe, that diaphragm is going to contract. And when it contracts, it flattens out, right? So the diaphragm's naturally not flattened out, and when you contract, it flattens out. Well, when it flattens out, it kind of pushes all of your guts in your abdomen, kind of pushes all that, makes it more crowded in there, and all your guts kind of push on this inferior vena cava. And that helps to push blood up. So for one thing, you're creating, when you push on the vena cava in your abdomen, you're creating a pressure, higher pressure. And the pressure's lower in your thorax than it is in the abdomen. So the blood wants to go from the higher pressure to the lower pressure. So that's how the respiratory pump works. Every time you breathe, it's helping to bring that blood up from your abdomen and pelvic area to your thoracic area. So that's the first part of blood vessel physiology. I believe I have 2 more videos on this. So as always, any questions on this, please let me know.